Good morning, students. Today we are continuing with the previous class. The previous class we have discussed about the pre-experimental design. We have completed true experimental design, post-experimental design, and the pre-experimental design. And what is remaining for us is the non-experimental research design. So in the non-experimental research design, all the three elements essential for the true experimental design will be absent. That means in the non-experimental research, there is no intervention, there is no control group in most of the designs. And some design, sometimes you can see a control group, but in most of the design, there is no control group and experimental group. And there is no randomization also. So all these three elements will be absent in the non-experimental research, or research in which all these elements are absent. We call as the non-experimental research. So non-experimental research is done either to describe different aspects of a phenomenon or to state the relationship between the variables. So that is why we are doing a non-experimental research. Sometimes it's only for a descriptive purpose. For example, we just want to describe, just like a poet describing a flower that fell on the ground, or they are describing a river that is flowing smoothly. So similarly, a researcher also wants to explain the scientific aspect of a phenomenon. Why it is happening, where it is happening, how it is happening, when it is happening. So all this phenomena will be simply described. For that we use non-experimental design. Or sometimes to establish or to state a relationship. We are not going into the details of this cause and effect relationship, but we are saying that there is a relationship between height and weight. So this simple type of relationship establishment also we are doing with the non-experimental research. So as I said, there are three important non-experimental research designs are there. One is a correlation research. We are trying to establish the relationship between the variables. Correlation research. Otherwise, it's called as a ex post facto design. Okay. And the second thing is a descriptive design, because it is mainly for the describing purpose. So it is a descriptive design. And there is a third form of design also is included in the non-experimental research, is a designs based on time dimension. So that few others classify like this, or few others will describe these researches or designs based on the time dimensions in a different entity also. So we are including that under the non-experimental research design. The three types of research design under non-experiment: correlational or ex post facto designs, descriptive designs, and the designs based on time dimension. A correlation research or ex post facto designs, there are three important types. The prospective designs, retrospective designs, and case control design. So we have prospective, that is a continuing design from this prospective. Whereas in the opposite direction is the retrospective design. And as I mentioned, there is a case and there is a control. The two groups are there. In that design we call as the case control design. Then designs based on the time dimensions are the cross-sectional designs and the longitudinal designs. So these are the two types of designs based on time dimension. One is cross-section at one section. Longitudinal is at different sections. That's called the longitudinal design. Correlational design, as I mentioned before, is the interrelationship or association between two or more variables are established. For example, the gender and the intelligence. We are trying to establish the relationship between these two variables. There is no intentional manipulation of independent variables by the researcher, because that is not possible also. But the variations in the independent variable have occurred in the natural course of events. Many variables are like that. We are not able to intervene, but the changes are taking place in the natural course of events. The measurements depends on the variable is done after that. So this design is called also as the ex post facto design, because our measurement of the dependent variable is done after the intervention by the natural events. That is why called as the ex post facto design. Now, we have discussed about the prospective design, retrospective design, and the case control design. I will see the details about what is a prospective design. As I mentioned, it is a progressive design. It starts from the cause to find out the effect. So that is why we call it as a prospective design. It is starting from the present and traveling to the future. Okay, the study will start by selecting a group of samples who have risk factors, and there's another group sometimes who are not having a risk factors also. So from the cause, we travel and find out the effect of that. That is naturally occurring. There is no intervention as such. For example, the classical study for this, the prospective design, is a study that is done on the British doctors who are smokers. They have selected around 500 samples, 500 doctors who are smokers, and they were assessed for any presence of lung disease or any other problems, health problems. And every 6 months or 1 year, the follow-up is done at 6 months interval. Again, they have questionnaire given. They were assessed for any presence of disease. And this is continued for 5 years. And at what time and when each person is getting a lung disease or health problem, that is, we have to find out. So this is a prospective design. The cause is that they are smokers, but it's not an intervention. And naturally, they are smokers, and naturally things are happening, effect is happening, and we are just measuring that effect. So this is called as a prospective study. Prospective study start from the cause at any time. Sometimes the cause might have happened before we are starting at any time, and we just find out what is the effect of this cause on the effect. So what is the effect in later period of time? So we go along with the patients, along with the time, and we will find out the effect of that. This is a prospective design. Now, the just opposite is a retrospective design. You might have heard about in the film screening around retrospectives. That is the past. What has happened in the past? That is retrospective. So here we are traveling, we are starting from the present and traveling to the past. With a perspective from the present to the future. This present to the past. So we start from the effect to find out the cause. So what happened to them before? For example, we have so many persons with lung cancer, and we just try to find out when they started smoking, what is their smoking pattern, whether they are passive smoking or active smokers, whether they are in any exposure to industries and any other factors. So we are just trying to find out when all these things into the past. For that, we may utilize some of the records, history collections, clinical examinations, and medical records, and all those things will be reviewed for. So this is retrospective design. Start from the presumed effect and try to find out the cause. The data collection is from the present to the past. Study is started by selecting patients who have bladder cancer and see different aspects of saccharin used by them. That's another example. So this is a retrospective design. So prospective design versus the retrospective design. And next one is a case control design. The case control design, as the name indicates, the case is there and the control also is there. There are two groups are there. But this is entirely different from the experimental group and the control group. The function is same. Control group is for the control and case is as a case. The case control design is a form of retrospective design. When two groups of subjects with effects and without effect. Okay. And we are going into the past to see the cause. So this design is called as a case control design. For example, here we are selecting one group of patients with bladder cancer and another group of persons with as a control group with no bladder cancer. And now when we see the about the saccharin intake or about other aspects and all, it is making us more clear and than the retrospective design about the surety is more. We know that these factors were absent in the control group, whereas this is present in the case group. So we are making sure that this is somewhat sure that these are the factors which are causing the bladder cancer. On the previous example, the lung cancer or the lung problems and the smokers. We can make sure that it is little more sure that because the control group is not having any lung problems or lung cancers, whereas the case is having only because of this particular process or maybe because of this particular process. So this is a case control design. There are two groups. We are selecting two groups with one with the effect and another without effect, and then we are going to the past to see what are the causes that especially present in the case. Okay, so this is a case control design. So we have discussed all these three designs: prospective design, retrospective design, and the case control design. So this is a comparison between prospective design and retrospective design. Prospective design start with a cause, whereas a retrospective start with the effect. Prospective tries to find out the effect, whereas this tries to find out the cause. Prospective proceed from present to the future, whereas the retrospective proceeds from present to the past. And prospective is more costly because we are starting from the cause and we have to follow up the patient several times. More examination to be done. They have to come back for reviews. So it is more costly. Whereas the retrospective is less costly because we are only looking at the charts and some questionnaire may be given. So mainly it is a chart medical record examination. So it is less costly. Prospective, again, it is more time consuming. Retrospective is less time consuming. Prospective again need more samples, and retrospective can be carried out with less sample size also. And there is more chance of subject attrition in prospective design because after some time, some people say that no, I am not continuing the study, just stopping. Or some person may become more sick and die also. So this attrition rate is more in prospective design, and retrospective design the less attrition rate. Again, in the prospective design, we have to get an ethical committee approval. That is, a strict approval is needed from the ethical committees also. As a retrospective design, ethical committee approval actually is not needed. The strict ethical committee approval is not needed in the retrospective design. So these are some of the differences between prospective designs and the retrospective design that can be asked as a question for the exam. Now we are coming to the descriptive design. Descriptive research is used to observe, describe, and document an aspect of a situation as it naturally occurs. This design is also used for hypothesis generation and for developing theories. So when a descriptive design is used for exploring a phenomena, it is called as the explorative design. And when we use it for comparison of different groups, it is called as a comparative descriptive design. So description is the only important purpose. Sometimes we may extend the description to a form of theory generation or the hypothesis generation, but we will not test theories in the descriptive design. For testing, again we have to go for some other form of designs. Either true experimental or quasi-experimental, go for another form of research design for testing hypothesis. But developing hypothesis can be done with a descriptive design. So these are the two types. When we explore further and further to the causes, to all these 5 phenomena like why, when, how, where, etc., that called as a explorative design. And when we use description for comparison purpose, for example, the infant mortality rate in different countries, for comparative purpose, it's called as a comparative descriptive design. The next is a cross-sectional design. So in the cross-section design, the collection of data is done only at one point of. For example, in your +2 classes, you have taken the cross-section of the stem. Or in anatomy, you have learned about the cross-section of stomach or liver, etc., where you're just cutting at a plane and observe what is present in that particular cut, cross-section. Sometimes we will stain and look at under the microscope. So what is there at the single plane? That is cross-section. So we are collecting data only at one point of time. In epidemiology classes of community medicine, we have discussed or studied about the prevalence of a disease and the incidence of a disease. What is prevalence of a disease? The total number of cases at one point of time, the prevalence of a disease. For example, when we say that the prevalence of a disease, COVID-19, at present is around 10,000 cases. This is the prevalence. At one point of time, what is the total number of cases? This is the prevalence. It is a cross-section study. So this design is used for describing the status of a phenomena or for describing the relationship among phenomena at a fixed point of time. So in photography, you know that there are different types of photographies are there. Still photography using a still camera, video photography using a video camera. If you are taking a still photo, what we are getting is only at one point of time. Just click and how we stand. Some person will be sitting with their mouth open. Sometimes some persons will close their eyes. But whatever at that particular point of time, you will get the picture. The cross-sectional study is also like a still photograph. What is at that point of time, at that particular plane, that we collect, data will collect. We are not bothered about any progressive. at that particular, and that we call as a cross-sectional design. Whereas in the longitudinal design, the collection of data is done at more than one point of time. So we may collect data twice, thrice, or at several times. For example, the incidence of a disease. What is the incidence of disease? Is a, you know, that is a total number of new cases that is occurring within a period, say 1 year. So that is the incidence. So if we are collecting the data at 2020 January, in 2021 January, we will collect data. And what is the difference between these prevalences? We call it a number of new cases. That is an incidence. For example, we have doing a SCABE study in a classroom. For example, in third year BSc nursing students, we are saying that in 2019 January, there are 20 cases are there. And 2020 January, again we estimated there are 30 cases are there. That is a prevalence, 30 cases. The difference between 20 and 30 is 10. The total number of new cases is 10. So this is the incidence of a disease. And this is done is a longitudinal study because we are collecting the data at a 2 point of time. The collection of data is done at more than 1 point of time. In the previous example, this is something like a videography. At a period of time, we are just taking the photos. It is not at one point, it is a period. So this is the longitudinal design. So cross-sectional design towards longitudinal design is that cross-section, we collect the data only at one point, whereas we collect data at more than one point in longitudinal design. There are so many longitudinal designs are there. In there, we collect data at several points of time. These are some of the studies or designs and the longitudinal design: cohort study, trend study, panel study, and follow-up study. These are the few examples of longitudinal designs. What is a cohort study is? Cohort is a specific subpopulation. That is why we call as a cohort of sheep or cohort of camels, etc. It's a specific subpopulation that is examined over a time. This particular subpopulation will be examined at more than one point of time. So that becomes a longitudinal study, and because it is a subpopulation, we call it as a cohort. So it's called as a cohort study. The second thing is the trend study. Trend study is used to examine the patterns and nature of changes over a time. It is also used for predicting future trends. Now, take for example, I'm just doing a study on 2010 batch BSc nursing students about their fashion, about their attitude, about their fashion, about their behavior, etc. So many things we are studying. And again, 2015 batch also I'm just doing this study, or I'm just following this study, 2000 every batch to 2015. So 5 years, I'm just getting the trend. What is the change in the trend? So I'm just able to say that. So this is I'm collecting data at every year, means 4 years or 5 years I'm collecting the data. And I'm able to say this is a pattern and this is the nature of change over the time. According to that, I can predict also this may be the change. If this continues, the next 5 years, those students who are going to come at 2020, this will be their trend. This will be their nature of phone use. This will be the nature of their behavior. This will be their fashion, etc. So I am able to plan a lot of things. The curriculum planning, extracurricular planning, even the structured library, everything can be planned by predicting the trends, future trends. So this study, we call it as a trend study. And the third form is the panel study. Panel study is that data collection is done from the same panel of subject over a period of time. For example, the British doctors who are studied, the same panel we just followed for a period of time. So this is called as a panel study. Data collection is done from the same panel of subjects over a period of time. The follow-up study means it is done to identify subsequent changes in subject who have specific conditions or who have received a specific intervention. You know that we'll write follow-up for the patients after 1 week or after 1 month or every month. They should come for review. That is a follow-up. Similarly, we follow the subjects of the study at a period of intervals or subsequent periods. Those who have some conditions. For example, we just want to we did a surgery, and after that we just want to see what is the effect of this surgery, how it is progressing, or any other complications are developed by frequent reviewing. So this type of study we call it a follow-up study. So longitudinal designs, we have discussed what is a longitudinal design, and there are so many types of longitudinal designs are there because we are collecting the data at more than one point of time. They are the cohort studies, trend studies, panel studies, and follow-up studies. Now, yes, we are seeing about what are the advantages and disadvantages of the non-experimental design. The advantage is mainly the disadvantages of the experimental design. This is more practical and economical. It is more efficient and effective means of collecting large amount of data about a problem area. Also, it's an important role in nursing, medical, and social studies. We are able to conduct a more number of research in this profession, mainly because getting permissions, practical issues, ethical issues are all more in the experimental design. Whereas all these things are less, so it's more practical in professional researchers. So these are the advantages of non-experimental design. More practical and economical, is more efficient and effective means of collecting large amount of data, and is important role in the professional research. The disadvantage is difficulty in getting causal relationship, because it's very difficult to say that this effect is occurred only because of this cause, because this is naturally occurring and we just want to do some data collection. It's mainly for descriptive purpose. The intention itself is a descriptive purpose. We don't want to get a causal relationship. So it is difficult to get a causal relationship in the non-experimental design. The possibility of faulty interpretations are there. If the researcher is not skillful enough, the novice researchers, or they are not having adequate guidance, or if they have not collected the needed data, or some biases have occurred, possibility of faulty interpretations are there. So with that, we'll stop the non-experimental design, and in the next class we will discuss about the qualitative design.